Hi, everyone. My name is Nicole Fournier, and I am currently an emergency medicine registered nurse pursuing advanced practice licensure in the psychiatric mental health field. So I stand before Congress today expressing my support of the Senate Bill 675, an act relative to mental health parity implementation. I work at two different emergency departments, both with behavioral health units. And within the last 5 years of being a nurse, I have witnessed countless people coming into the ER looking for help with their mental illnesses or worse, mental health crises. Too many times I've been told by patients, their families, or their friends of their reluctance to seek medical help due to cost and lack of adequate insurance coverage. A common phrase that is typically heard within my conversations with these patients is, I cannot afford this, I can't pay for this, I can no longer be here, as they become more and more distressed during their visit. Unfortunately, some of these patients wait too long and come to the ER amidst a mental health crisis, and this is not okay. Changes must be made to decrease the occurrence of such situations. Now, back in 1996, the Mental Health Parity Act was endorsed, and what followed was the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act in 2008. The purpose of these acts was to improve access and affordability to mental health care, also assuring that mental health was equally as important to physical health. These acts required commissioners of insurance to implement and enforce provisions of the act. Therefore, we would need to meticulously evaluate costs and fees of mental health services or substance disorder treatment to verify that compliance by insurance companies was being followed. The problem is, as seen over the years, is that these laws are not being followed. Although some major and obvious violations have been unearthed and corrected, many of the smaller and less obvious ones need attention. This is where this bill would come into play. To ensure compliance, the bill includes a list of strict guidelines and regulations for carriers to follow, such as requiring the carrier to change the benefits standard or practice, requiring carriers to provide training to staff regarding any changes to benefits and practice, and requiring the carrier to submit to ongoing monitoring to verify compliance. And there's many more. There is certainly an urgent need for mental health care to be addressed and improved. As of 2008, statistics showed that 6 in 10 Americans are in need of mental health services. And now, with the effects of the COVID-19 pandemic, the likelihood of these numbers is rising high. We have 74% of Americans believing that mental health services are not accessible to everyone. So, with this national consensus, steps must be taken now. We need to improve public health, decrease the risk of suicide, legal issues, family conflict, and substance use, all of which can arise from untreated mental illnesses. I thank you for your time and consideration to strengthen the mental health parity.